Hey everyone, welcome back to another YouTube video with NCLEX reviews. My name is Samantha and today we are looking at a full case study which involves various client information that is then used throughout multiple NexGen NCLEX style questions. Now if you haven't reviewed our other YouTube videos breaking down each NGN question type, now is a great time to pause this video and go and review. Before we get to the practice case study, let's first explain what you can see within these. The more you know, the better prepared you will be, as you never want to get into an exam not knowing what to expect. With the next generation NCLEX, you can expect to have 3 case studies throughout your exam, and each case study has 6 accompanying questions. Case studies are designed to measure clinical judgment by providing a real-world nursing scenario that simulates a real client chart accompanied by those several questions. Remember, you do not have to get every selection correct to get points within the case study. This is a huge perk of the NexGen NCLEX, a partial credit. So if you are ever unsure, definitely try your very, very best. So how are case studies set up on your NGN? The screen will appear with several pages on the right-hand side. This alerts you that this is a case study. So for example, it may say case study screen 1 of 6 or 5 of 6, so you always know where you are within that case study. You will see a one-liner at the top of the table that sets the stage. And on the left side of the screen, you will have tabs that provide more information through an electronic medical record. So this may include information like history and physical, nurse's notes, and lab results. You will use this information to answer those 6 accompanying questions within that case study, and you will have access to this screen at all times. Now on the right side are the questions for the case study. Again, you'll be asked 6 different questions that will include several different styles, such as an extended drag and drop, closed questions, answering items in a matrix or grid, extended multiple response, or even a highlighting question. Remember, the exam is testing if you will be a safe, competent new registered nurse. And being a safe novice RN includes identifying client priorities, recognizing key clues, and then taking the appropriate action. And while it may be clear that you need to have some basic content to successfully answer these, we also like to reiterate your anxiety management plan. The amount of information and questions to answer within case studies can be overwhelming at first glance. But remember to take a minute to close your eyes, take a deep breath, and then take it one section at a time. All right, let's jump into our practice case study and let's talk about a plan of attack here. So we have a 65-year-old man is brought to the emergency department or ED by a family member. Let's first look at all the information provided here, looking for any concerning findings or red flags. We are starting with one tab here, but we will have more as we go along. So let's get started with this nurse's note. So it's time-stamped for 12:46. Client admitted to the emergency department. Family member states the client was sitting eating lunch around 12:20 when they noticed the client dropping his fork and he could not continue to eat. The family member tried to assist the client, but the client did not understand directions and had a glazed look. Current vital signs are a blood pressure of 165/97 millimeters per mercury, heart rate of 105 beats per minute, respirations 20 breaths per minute, SpO2 97% on room air, and a temperature of 97.8 degrees Fahrenheit. Family members report a past medical history of asthma and hypertension for the client. On assessment, client is alert and oriented ×2 to person and year, disoriented to place, and slurred speech is noted. There's also a right-sided facial droop noted, right-sided weakness noted with 3 out of 5 grip strength. His color appears appropriate for ethnicity and his skin is clammy to touch. Respirations even and unlabored. S1 and S2 heart sounds auscultated with no S3 or S4 heart sounds noted at a regular rhythm. Cap refill is less than 3 seconds, radial pulses 3+ bilaterally, and the heart rate monitor shows tachycardia on admission. Now that we have reviewed our first screen, let's look at our first question, which is a highlight style question. Highlight the top findings that will require follow-up by the nurse. Remember, These will be pre-selected areas of text for you to click on, but go ahead and determine which findings you would select for follow-up within this nurse's note. And again, that nurse's note is on the left for you. So, first, what are our client's symptoms consistent with? A stroke, absolutely. Also known as a cerebrovascular accident or a CVA. And once we determine that, we can point out the top 4 findings that point us towards a stroke. Unilateral weakness, slurred speech, and a facial droop are huge red flags of a stroke. Disorientation is common to see with clients experiencing a stroke also. And as a bonus question, what is the area in the brain responsible for speech production? Broca's area. And then what mnemonic do we love for stroke? Be fast. Now, be fast stands for balance, eyes, face, arms, speech, and time, referring to those important symptoms and urgency. And along the same lines of acting fast, we absolutely need to note the time of onset, as it is crucial that this is going to be treated quickly. So what time frame is ideal? Do you remember? Time is brain. Remember the golden hour. We have the best probability to restore blood flow and save tissue within that first hour of symptoms. And lastly, our client is a little disoriented here, which is our last main finding to report out of the list provided. Great work, everyone. Moving on to our next screen of this case study, question 2 of 6. Let's take a look at this next question, which is a matrix multiple response style question. This will be presented in a grid or a table of some of the assessment findings can be pertinent for more than one condition, since this is a multiple response. So, for each client finding below, click to specify if the finding is consistent with the disease process of a cerebrovascular accident, hypertensive encephalopathy, or hypoglycemia. And note, each column must have at least one option selected. Our 3 conditions listed again are that cerebrovascular accident, hypertensive encephalopathy, and hypoglycemia. So we definitely want to look at each finding individually and answer which condition that can be seen in. Note again that each column must have at least one response option selected, but can have more than one. Pause if you need to and jump in when you're ready. Let's review our answers here. So a right-sided facial droop and weakness would definitely heighten our suspicion for a stroke, especially with our client's increased blood pressure. Clammy skin is a common finding of hypoglycemia. Think cold and clammy, need some candy. Now, confusion could be related to all 3, right? Weakness could be seen within both hypoglycemia as well as a stroke. And lastly, hypertension could be seen with that stroke as previously mentioned, as well as that hypertensive encephalopathy. On to our next part of this case study. And for this one, let's look back at those assessment findings again. Now we have a drop-down close style question. Complete the following sentence by choosing from the list of options. The client is at highest risk for blank. This is evidenced by the client's blank. Pause if you need to, and we'll work through this one together. So with that first blank, this client is very suspicious for what? Well, we have already mentioned all those red flags for a stroke. And what is that based on? Based on our neurological assessment, our client has that right-sided facial droop, right-sided weakness, slurred speech, confusion, all the neuro findings here. We need to notify the provider and act quickly. Remember, time is brain, you all, and we do not want to delay care if we suspect any signs of stroke. Now, looking at our other choices for the first drop-down, the client's symptoms are not consistent with a pulmonary embolism, and while we may have a few concerning findings like the cold and clammy skin, the findings are most consistent with a stroke. Now, moving on here, we obtain more information. Let's review our next piece of information given by the nurse's note. It's timestamped for 12:55. Client is now disoriented to person, place, and time with right-sided facial droop and right-sided weakness. Daughter's at bedside, keep stating, "This is not like my father. This is not normal for him." The client has slurred speech. Current vital signs are 190 over 105 millimeters per mercury, respirations 18 breaths per minute, heart rate 103 beats per minute, an O2 saturation of 96% on room air, and a temperature of 98.1 degrees Fahrenheit. Now, the nurse has reviewed the nurse's note entry from 12:55 and is now planning care for the client. So now we have a matrix multiple response question. For each potential nursing intervention, click to specify whether the intervention is indicated or not indicated at this time for the care of the client. So our potential interventions are: administer standing order of IV labetalol, alert the rapid response team, initiate 2 liters of oxygen via nasal cannula, keep the client NPO, maintain a patent IV, notify the provider of status change, or notify physical therapy for evaluation. Go ahead and pause if you need to, and we'll review together. So we absolutely need to notify the provider if we have a change in client condition, as noted by that deteriorating orientation we are seeing here with our client. We would also want to notify the rapid response team. Now, if you are in the emergency room, you will have access to this rapid response team, or there may even be an isolated stroke team that you will need to notify. In this question, however, we will want to notify this team for rapid intervention. We are also anticipating that this client will need an MRI of the head to diagnostically determine stroke due to this client's presentation. And for any emergent client, we need to keep a patent functioning IV line in case we need to administer any critical medications. We also want to keep this client NPO at this time, meaning nothing to eat or drink, as there is a risk of aspiration. We also need to get this blood pressure down. This is an extremely high blood pressure, and it could worsen our client's condition even further. As a registered nurse, you will have standing orders, and depending on the area you work, whether that's med-surg or in the ER, will dictate what kind of standing orders you will have. It will also clarify those parameters of when you can administer it. So for example, labetalol 10 milligrams IV for a systolic blood pressure greater than 165. So for this client, since his blood pressure is greater than 185 over 105, we will definitely go ahead and administer labetalol, which is a beta blocker, as an appropriate action. Now, our client will need physical therapy to come for an evaluation and treatment eventually, but at this time, it is not our priority. And we would also not need to initiate 2 liters of oxygen via nasal cannula, as his current oxygenation is okay at this time at 96% on room air. So moving on to our next question, we obtain MRI results. Review the MRI results and complete the next question we have. So timestamp for 1310. Provider reviewed results from MRI. Provider determined the medical diagnosis is a hemorrhagic stroke. So the nurse has reviewed the MRI results. Click to highlight the following orders that should be performed right away. That's it. Administer thrombolytic therapy, administer a fluid bolus, administer nicardipine, apply non-chemical restraints, or insert an indwelling urinary catheter. Our priority orders to implement at this time would be administering nicardipine and inserting an indwelling catheter for our client. We would want to give that nicardipine, which is a calcium channel blocker, and this is used to control blood pressure, which we need to do. This client will require frequent blood pressure monitoring. High blood pressure can cause more damage to the brain that is already injured and make this bleed worse. Our client also has right-sided weakness due to the stroke, meaning mobility issues. Therefore, we need to place an indwelling catheter until strength is returned and the client is able to be mobile again. More than likely, this client will be transferred to an acute care unit to manage and stabilize his care. Now, as another bonus question, what kind of precautions should the registered nurse expect to implement with this client? Definitely seizure precaution. Now, looking at our other incorrect answers, we absolutely need to make sure that we are addressing the cause of the stroke. Based on the MRI results, it was determined this was a hemorrhagic stroke. So, we do not want to give thrombolytic therapy to this client, as it will just make the situation worse and increase the risk of bleeding. Our client has no indication of a fluid bolus at this time. Their blood pressure is already very elevated, and we wouldn't want to make this worse. And lastly, non-chemical restraints are not necessary at this time. The client may be disoriented, but the RN should provide safety precautions and reorient as needed. All right, everyone, our last and final question within this case study. It's a matrix multiple choice. The registered nurse in the acute care unit is assessing the client again after the client has stabilized and notes the following assessment findings. Select which assessment finding would be an improved status, decline of status, or no change for this client. And note, select one column per assessment finding. So we have our assessment findings: respirations of 30 breaths per minute, blood pressure of 135/85, an SpO2 of 91%, following commands, and a facial droop to the right side. All right, let's break this one down. The best way to handle this question is to ask ourselves, is this particular assessment finding an improved status, decline in status, or no change in status as compared to our last assessment we had, which you can see to the left? As far as our respiration rate, a rate of 30 respirations per minute is considered tachypnea or fast breathing. This is not a normal finding, nor did the client have tachypnea in our previous assessments. Therefore, we have a decline in status. Now, what do you think about a blood pressure of 135/85? Well, it might not be a completely normal blood pressure, but it has decreased closer to normal range, making it an improvement in status from the previous blood pressures we have seen throughout this case study. So this would be an improved finding. Now, would an SpO2 of 91% be an improved, unchanged, or decline in status? This would definitely be a decline in status if the client's oxygen dropped from our previous noted O2 levels. Now, what about our client that can now follow commands? Remember, earlier this client was a little disoriented and unable to follow directions. So this is definitely an improvement. Lastly, this client has a right-sided facial droop, which they had upon admission at the beginning of our case scenario. So this would be an assessment finding that has remained unchanged. Great work, you all. I know these case scenarios are long, but if we break this case study down into 6 different questions with a twist, it's not so bad. Just remember to take your time and review all the information that is given. Remember, take it one question at a time. We are rooting for you, and we know that you can absolutely do this. Make sure you hit subscribe so you don't miss out on another video from NCLEX Reviews, and we will see you in the next video. Happy studying!